Stacy Flowers is here with Direct Primary Care Associates. Stacy, what's going on with you?
Not much. We're just out in the community wanting to spread the word. You know, we've gone through open enrollment, many companies have, and have seen how much that insurance premiums have increased. I don't know of many people that have come out unscathed by that, not feeling that in their pocket, and maybe those insurance premiums have increased, and maybe to keep a lower premium you had to take a plan that had a much higher deductible, much higher out of pocket, and so we wanted to make sure that the community knows that we're there to fill the gap. Starting January 1, HSA money can be used to pay for direct primary care memberships, so that's something that was a part of that big beautiful bill. And so what that means is for people who are having to pay a lot out of pocket, they can use those HSA dollars and pay for a direct primary care membership and for the care they plan to have. So this is their well visits, their sick visits, routine lab work, routine medications. Those things can be gotten with Direct Primary Care Associates for one low monthly membership fee. For individual members, $79 a month. For families, it's a little bit more, and then we do have agreements with companies that maybe you're providing this in lieu of an insurance policy, or maybe as an addendum to a high deductible plan. And so we wanted to make sure that our community knows that there is a way to access primary care with transparent cost, with all upfront pricing. There's never hidden fees, that you can have a way to spend more time with your provider to get better quality care, more time with your provider, more things free for a really low cost.
We're joined by Stacy Flowers, Direct Primary Care Associates, and that's actually what I was going to say is that, I mean, it's not, you don't just rush people in and out of the office. You actually spend time with them, and then the providers are available to people when they need them.
That's right. That's right. We try to spend at least 30 minutes to an hour with every patient. So that's for new visits, for well visits, where maybe you have some complex things that we need to discuss, some puzzle pieces that we need to put together. And we're going to spend an hour with you. For those sick visits, follow-ups, if you need it, 30 minutes and more if you can plan for that with your provider. But that's something that we take very intentionally. Each of our providers has their own panel of patients. We try to keep, when you come through the door, we try to keep you with the same provider every time that you come in. So when you speak to someone, you're speaking to someone that knows you, someone that you've established a relationship with. And then we have after hours availability for telemedicine visits, to be able to talk to people and work through those things that maybe you would think to get up and go to an urgent care for, but we don't want our people spending money to go to an urgent care for things that we can take care of for free. And so we establish that relationship and have that availability so that for those weekend or holiday moments that you don't plan for, that you have someone that you can text or call directly.
Of course, we're getting in that holiday period here very quickly. All right, Stacy, so what's the best way for people to find out all of this information?
You can check our website out, directprimarycareassociates.com, or you can call us at our Cleveland office, 423-650-4831.
All right, Stacy, happy Thanksgiving.
Thank you, sir.
We'll see you along the way. All right, it is 8:31 as